Welcome to the Secrets to Mindful Health, where we explore the hidden truths of wellness in all its forms. From physical and mental health to spirituality, join me, your host, Beth Warren, at Nourished by Beth on Instagram and TikTok, registered dietitian for over a decade, and single mom of 6, as I share my personal journey overcoming challenges towards self-love and wellness. Together with my guests, we will inspire and motivate you to prioritize your well-being and create a life of balance and fulfillment. Let's embark on a transformative journey towards a healthier, happier you. I'm glad you're here. In today's episode, Inside Your Gut, Dr. Shan's Secrets to Navigating Gastrointestinal Health. Dr. Shan is a board-certified consultant gastroenterologist practicing in Iowa. He focuses on providing personalized care in luminal gastroenterology, hepatology, and pancreatology. With expertise in diagnostic and therapeutic endoscopic procedures, Dr. Shan is dedicated to helping patients manage complex gastrointestinal conditions. His Instagram is gastroenterology.md.doc. In this episode, discover the importance of personalized care in managing complex GI conditions with his valuable insights and tips for maintaining optimal gut health, empowering listeners to take charge of their digestive wellness. Welcome, Dr. Shan.
Awesome. Thank you so much for having me.
So I always am curious with GI doctors because first of all, I love talking about the gut because I do nutrition and I love, I mean, I don't know if you're like this as a doctor, but I love like working with specialized cases, and I have to work about a special diet versus oh, okay, I just want to come here to lose weight. I'm like, sure, here's what you do, here's what you eat. But I actually specialize in GI related diets.
Awesome.
I'm talking FODMAP, just trying gluten free, dairy free, and then all the intricacies related to that in terms of food labels and reading, and then recipes and how am I going to eat out and
Yes.
practically and menu planning and all that. And the world has come such a long way. So at least, even though it's always difficult to make any adjustment to your diet, at least these days they make it easier. So I'm curious where you came out, or at least how it evolved, why you became a GI doctor. Like, what is it about it that you really like latched onto and is your thing about it?
In terms of what got me to GI,
Yeah,
gastroenterology,
GI, and now
you
like
know,
and what do you specialize in within that?
so, in terms of GI, right, after medical school residency, there's always a question, what do you want to do? I felt like I wanted a field where there was a good mix of things. Like, it's not just sitting in the clinic, seeing patients, but there was always an aspect of, doing procedures. So I think GI it's a good mix of everything. So you part of your time is you're in the clinic analyzing things, putting the puzzle together, but part of the time you're doing procedures. And on top of that, a big part of my job is being on call and dealing with emergency stuff like bleeding patients or people with obstructions, things like. So this was a good mix. So it's not a pure medical field. There's a semi-surgical side to it. So that's what drew me to GI. And initially I wanted to be cardiology, but then I got scared by the EKG line. So then obviously that I had to shift away from that to GI, which seemed much more straightforward. You see something and then you take biopsy. So that's what drew me to GI. It's very straightforward and it has a good mix of multiple skills as a doctor.
And then over the years, did it evolve like with things that you were finding? Like, for example, as a dietitian, I'll just, oh, I want to come to lose weight. Okay, here's what to eat. But why are most people not managing their weight? Because there's other reasons why they don't keep a diet and other lifestyle things and other emotional issues and other things. Like, how has it evolved over time in your practice of what you see?
Some of the things, it's interesting. So I did my med school actually outside US. So then I came to US for residency. So many things that we see here, like for instance, inflammatory bowel disease or this prevalent irritable bowel syndrome, C. diff colitis. These are things which I never came across. I mean, in this much volume when I was in medical school.
Wow.
So it's completely different. And I always used to wonder why would that be. One thing about celiac disease is, especially from where I come from, I'm originally from South India, where the diet is predominantly rice based. So many times celiac probably might get masked or just does not show up at all.
Mm.
That was one hypothesis which I always learned. Why don't we see celiac that much in from where I did medical school? But so that was when I came here, as a resident, more towards, during my GI fellowship, I was like, oh, celiac, this is not a rare thing. This is very, very common. And the interesting thing is, it's the patient characteristics, or the patient who you might suspect, or you might see a patient like, oh, this might be celiac. Their patient demographics can be very, very different. There are
Mm.
times when you see a young patient with all the right symptoms, but there are times when I see a 50 or 60-year-old patient, and they're like, this could be celiac, and that ends up being celiac. So that was one major shift. The other thing was, especially from the celiac standpoint, one thing which was very striking was many times they get referred to me for something completely different, like elevated liver enzymes or some fatty
Mm.
liver, and be completely, this is something which probably was never looked into. But celiac, this is one thing which we always have to check when there's unexplained elevated liver enzymes. That's something which, through my practice, I've noticed that, this is very common. The other thing through the practice, whenever you find one autoimmune condition in somebody, that means their body has a tendency to make do that immune response towards their different tissues.
Mm.
So then I become more alerted to look for autoimmune conditions, no matter what their symptoms are. So we just always have to have that broad mindset that when the body is telling you that there's a tendency to have an autoimmune response, there's a good possibility there's multiple other things happening at the same time. So that's been something which has changed my practice. So you're a little bit more vigilant to look for inflammatory bowel disease, celiac disease. As you said, when it comes to diet, it's not just, as gastroenterologist, it's not just a diet for weight loss that I deal with. As irritable bowel syndrome, functional dyspepsia,
Mm.
these are very prevalent, and probably, as you said, low FODMAP diet probably has the you know most benefit in terms of these conditions, but very challenging to do. As
Mm.
you probably know, as a dietitian, how challenging can be. The list is just, I cannot remember everything in the list. That's
Yeah.
exhausting. So many times, we now very closely work with dietitians, and we tell the patients, what, we know it's not an easy thing to do. Give it a try, and probably you do this more than me with patients. Avoiding things and reintroducing slowly to see what could be the culprit, avoiding
Yeah.
those. Third thing over the practice I've learned is, artificial sweeteners, which is much
Mm-hmm.
more prevalent in our society right now. And a lot of people just don't realize that that could be the cause for their abdominal bloating. Like, this
Yes.
is not something which, if you're not in the healthcare field, or if you haven't done research on this yourself, you never know, right? If you take this, that you're going to get these extra symptoms sometimes with it.
Yeah.
Third thing, just like artificial sweeteners, soda, diet sodas is the other thing, which people just don't recognize. How it could cause a lot of GI symptoms.
Yeah.
The most recent being the GLP-1 medications. The just the amount of new symptoms, GI symptoms, which come with it, and sometimes you actually have to sit down and track the medications which were started, and then you can actually, you also then you can pinpoint, oh, this is when you started the medication, this is when your symptoms start.
Mm. Oh my gosh, we have to break all those apart and then I think focus on the last because that actually I'm seeing that in my practice too.
Yes.
All of us. I mean, the smart ones that still come to a dietitian on it. That's the smart way to do it. But okay, we'll get back to that one because that's a big one. I always had a thing with diet sodas. I'm actually not that person that is a restrictive person. I more just educate and you make your own choices. But the artificial sweeteners significantly affect gut bacteria. And like you said, it's very interesting. I don't know if you found this in our society also, but people normalize things that are not normal because they're so used to living with it and they then start to compensate. And aside from just it affecting a spiral downward of their health over time, it's normal to them, which feels sad because your quality of life is impacted.
Exactly.
So, artificial sweeteners, I always, when I flag that, it's not because I have a problem with anyone choosing to have it. It's just that I know they're having more than they think because it's also sweeter than sugar. So,
Yes.
and it's also making them crave more and not really squashing it. There's other things about it, but when it comes to your gut, it causes a lot of bloating symptoms, and people are typically coming to me a lot for aesthetics, and it's bloating you. But it's so normal, and there's no calories, and etc. So that was a cool one to bring up. But GLP-1, I just actually had a client who I've seen in the past come back to me, and people know I'm a very non-judgmental, open-minded. I really do want to help someone. I don't make people feel bad about things. Like I rather you tell me, it's like a parent, you're afraid to tell them some like I failed math, but tell me because I'll get you a tutor or I'll help you out, right? But it's you don't want to. So I like when clients come back and she's like, I'm on the GLP, I'm on Manjaro. I said, that's okay. let's make sure your diet could be as good as it could be, blah, blah, blah. And she goes, as we're talking, she's like, but I'm so constipated. She said, like, I do not go to the bathroom. So if you want to just explain a little bit of why that happens, because it's not only that they're not intaking fiber and food,
Yes.
period, but
Yeah.
there's other mechanisms at play there.
You know, the the sad thing is not as sad. I mean, basically, this is one of its mechanisms how it acts.
Yes.
The way the internally the GLP-1 medications act, it does slow down the gut. That has to do with multiple, biochemical pathways which come into the picture. But this is one of the mechanisms it acts. It slows down your stomach emptying. Your stomach, it slows down your transit to the small intestine. It causes constipation. Now, again, that's one way it acts, but obviously you get some symptoms from that, which many times patients are not aware, or sometimes they're not told ahead of time to expect these symptoms. The most distressing symptom that I've noticed that many people have significant abdominal pain, especially postprandial after eating. They get significant abdominal pain. Then
Mm.
they come say, I have early satiety nauseous. You know what? Early satiety nausea, probably that's one way it acts. It slows down your stomach so you don't eat a lot, and the food that you eat stays there longer, so you get full much faster. When I was a fellow and I was in training, that was the initial phase when GLP-1 agents were coming in at that time. So this was a couple of years ago. So at that time, many people got referred to us for delayed gastric emptying.
Mm-hmm.
And because probably their primary care doctor would do a gastric emptying scan while on GLP-1, there would be delayed emptying, and they would refer the patients for gastroparesis. And we were like, what? This is not
Mm.
unexpected. This is expected when you take.
Right.
But then I usually have a conversation with the patients. You know what? It's great medications help you lose weight, help for diabetes control, but these do come with it. Same way, if you have a gastric bypass, many of these symptoms come with gastric bypass too, or any sort of bariatric procedures. You get sometimes very bad postprandial symptoms. But interestingly, I've noticed that some patients have said, what, I had symptoms with this GLP-1 agent, but then when I switched to the other one, I don't have that much. Well, there's been rarely when abdominal pain has been severe when we had to stop all of
Mm.
those medications. That's been a rare incident. But more recently, from the GI world, a lot of literature on anesthesia risk if you don't stop GLP-1 agents at least a week before procedures.
Oh, that's a big one. Yes, I
That's a
did
big
see
one.
that.
There has been new studies, so they might have some changing guidelines to shorten that interval, how many days you have to stop it. But still, that's a definite risk. Two is from colonoscopy perspective, the quality of our
You probably
colonoscopy
got to do
prep.
an extra gallon.
Yes, the colonoscopy prep also has made me notice that GLP-1 does interfere with the quality of the colonoscopy prep.
Oh God.
But I also come across GLP-1 in its connection with the fatty liver treatment. So there has been excellent articles and data on people with fatty liver, especially with who have diabetes on top or overweight. Probably GLP-1 has some benefits there as well. So
Right. So, and well, I think how you started, you were just making a point to note that, like with any drug, there are side effects, and GI. I mean, the gut is like your center of everything. So but this literally directly impacts your gut because that's the intent of the GLP-1. But it's very interesting to know all these outside things. Is there a way to try to help it? Um, or is it, I guess, the same protocols that try to help it, or is it just not able to really be more than what it is?
in terms of handling the symptoms, you mean?
Yeah.
So, probably what we would recommend or what you would recommend as a dietitian to people with the delayed gastric empty and gastroparesis, probably that might be the way to go for these
Yeah.
symptoms as well. Physiologically speaking, that's the same mechanism. So probably diet changes, probably makes sense to have more frequent, smaller volume
Yeah.
meals. Probably there's some benefit in separating the fluids and the solids
Yeah.
during meals. probably avoiding a lot of food items which inherently is known to stay in the stomach, like more greasy foods, things like that, which inherently has delayed emptying from the stomach. Things like that probably has some benefit. Again, very, very rarely we have had luck switching from one agent to different agent. People's
Hmm.
symptoms are better. Extremely rarely we've had to stop those medications.
Yeah. I also was hearing similar from clients switching different things, and it seems to have some sort of different effect for people. Like some people tolerate some better. And then I've also asked about when you get the injection, that day or two, three after versus the next dose. I don't know if it's like, go make sure to go to the bathroom, like, go give yourself more time. I don't know. I've never said that yet, but I'm thinking as I'm speaking to you, might not be a bad idea.
Yeah. And sometimes, I mean, bodies behave differently, different medications. Maybe, if it is just small things that they can tweak, like when they take the injections, I mean, those are easy things to do. And
Yeah.
I always say, if you find something's working, go ahead for it.
Exactly.
Yeah.
It's well, GI in general, even reflux, anything. Yeah. There's suggestions on what affects it, but some people
Oh,
tolerate
yeah.
things okay.
I especially when it comes to acid reflux medications, I tell them, this is not like a cardiac medication which you have to take every day. If you feel like you can take it every other day and your symptoms are okay, 100% go for it. If you feel
Yeah.
like if you don't take your medications, you're doing well, I mean, please feel
Right.
free to stop the medication, because I would rather prefer you not being on these medications long term.
Yeah.
Um, I just take the lowest dose, the lowest frequency, what is needed for symptom control.
That's
Um,
great. That's great to note because a lot of doctors don't share that info. So
yeah,
it's nice, and it's nice to even know. I don't even think I necessarily knew that it's not. Yeah, it's not like cardiology,
yeah, yeah,
cholesterol medication
yeah. I was
statins and stuff.
And same thing with the constipation medications. I said, we should always aim to start the most benign step. That would be just increasing fiber, water
Yeah.
intake, maybe some fiber supplements. If that doesn't work, only then you go to the next step.
Yeah.
And
Yeah.
even as you go to the steps, I tell them, I'm not going to put you on a medication which those bigger guns for constipation. We're gonna just go slow there, because, and I tell them, one medication might work for somebody, it might not work for somebody else,
Right.
and there's no way anybody can predict which will be that one exactly is going to work. So there's going to be a trial and error, and there's going to be a, really, like, when we ask patients to take like laxatives, we said, if you feel like this is working better, just go for it.
Right.
Just titrate that dose based on what works best for you.
Yeah. And that's what I was thinking might have to come into play with these medications at a certain point is the GLP ones I'm speaking about. Well, even there's like Miralax and all that. I would assume they would have to try to use some of these supplemental things sometimes to get things cleared.
Oh, yeah. So
Yeah.
Miralax, I tell them the same thing. I mean, there are people who have to take this every day, but there are people who just have to take it once every other day or once in a while.
Right.
Whatever works out for you, find that sweet spot.
Yeah. It's nice to know that it's fluid, literally.
Yeah, yeah, that's one thing. In GI world, other than the inflammatory bowel disease medications, most of the other medications are very fluid.
Right.
The
Right.
IBD medications, we kind of get very nervous when there's a skip medication delay, but all the other medications in GI.
Yeah. I mean, it's interesting because in the beginning you put it so straightforward. You said you actually got into the field because it was pretty straightforward, and I was so surprised to hear that because I find, for you, from your perspective, you probably because you know what you're looking for and you know how to do what you're doing, but from there's so many things that like your gut, quote unquote, is a term, right? Like it really is just a term, even though it's referencing what it's referencing. It's an entire area. Like let's share me. I went on a crazy journey, and also it's so impacted by stress and sleep and all these things. I have actually 6 kids. I don't think you know that. So my best friend doctor is of course my OBGYN. Like why would I ever go to anyone else? I've my youngest is 5. I don't have a husband anymore, and I still go to him for everything because he makes such a relationship with them having so many children. They're like you always call them. It's funny, not funny. Okay. So I was getting pain, so I assumed it's like my pelvis, like pelvic pain. And I was even speaking on my Instagram, which I don't even share that level of personal, but I like to expose things. Like that's what this podcast is about. Like sharing, when something doesn't feel right or you're having pain, go try to get help. So I was exploring the GI route. I mean, not the GI, the gynecology
Mm.
route for like a year. I was like, no, but I still have pain. And he's just listening to me because we're close, I guess, and he's going that route. And there were some symptoms, nothing really. At some point this year, like a few months ago, he's like, Beth, it's not a gynecological issue. Like, you have to stop coming. But I was starting to identify then it was more upward. It was more my stomach. It was more like up here. I'm pointing like anybody could see me, but it's very interesting how you don't flag, or maybe for me, it's because I always had children and everything's associated with that.
Yes.
But I was like, wait a second, it's my like gut area. Like, wait, I think something's wrong. And I went on this journey. Oh my God. So that's why when you
Wow.
say it's straightforward, it's a journey
It
to
does.
figure
It
it
does.
out.
Definitely is. One thing I would say, there, when I say straightforward, I mean, many times, like the diagnosis standpoint, as I said, I mean, I get scared of EKGs.
Yeah.
But unlike EKGs, you actually see the tissue in front of you in GI device. But one thing I'll say, there are instances in GI when you have symptoms, we go on this journey, we do all the workup. And every time we don't find anything positive, right? So I always tell the patients ahead of time, you know what? The best news is we didn't find anything.
Yeah.
That's
Right.
actually
Of
best news.
course. Yes.
Anything I could have found today would have been more challenging than not finding something today.
Mm-hmm.
Some people need that reassurance, that it's the best diagnosis to have probably is still a normal looking every test.
Yeah.
But obviously, sometimes people can get frustrated that, they want answers and want something to go
Because they're
after.
also in pain.
In pain, yes. So I many times I would tell my patients, we didn't find anything that, and this is probably the best thing diagnosis to have too. Now, when we don't find anything, we don't have anything specific to go after, then we have to go after sometimes the symptoms and some of the lifestyle changes.
Mm-hmm.
And in terms of lifestyle changes, diet changes
Diet.
from
Yeah.
mentioned, cutting down alcohol, smoking habits, things like that. More recently, marijuana is the other thing which I have to
Kind of.
actually talk to them about to get off. Uh, Third is I tell them, when we go after symptoms, sometimes it involves, medications to handle if it is pain, control the pain, if it is
Mm-hmm.
nausea. Interestingly, right, I've had so many scenarios when we come across this, we get to this roadblock where there's no more options there's no
Mm-hmm.
more investigations. But many times after, a couple of months, patients come back to me and say, you know what, I feel great. So I always ask them, what did you do? Oh, I've been eating better. I've been
Mm-hmm.
exercising better. I just, my stress levels are down. So, it just, I don't know if you've seen this video by this Harvard neurosurgeon who just left neurosurgery. He posts one video on YouTube, which just went viral. He says, he was seeing a lot of patients for back pain and he would do surgery for them. Some people get better without any surgery. And they say the same thing. You know what? I changed my diet, working out more, my stress levels are down. So there are things where, we probably don't have great answers to say, you know what, this is why you got better, but people get better when they do some things,
Right. Right.
this brain gut connection, all this probably come with
Yeah.
them, and what are we eating has a role to do with many of the symptoms.
Yeah.
But this
I
does happen,
Yeah, and I think you made a good point and that's the route I took. First of all, I appreciated every doctor I worked with, which I can't always say that, and it was really refreshing to see they all took my pain seriously. I noticed that when you rate pain and you're dying in pain, people take you seriously, which is a good thing. Meaning they investigate. I noticed that. So for people listening, when they ask you what level of pain, think about that answer because I think it's a big marker I noticed in my journey. But they did everything right. I feel like first they went for the scans and the ultrasounds and the CAT scans and the whatever. Thank God, like you said, the best thing to happen is nothing. I mean, you have like impacted stool, like you have things that you don't really need to know that can't be causing that level of pain. But okay, but I flagged that because I do what I do, and I'm like, wait a second, I could fix that. Um, and then you do the colonoscopy. That's why I was like crying for these people who might have to do another gallon. I never called my mommy at midnight and in 30 years. I called her at like 10:30 at night when you got to finish it. I was like, Ma, I can't drink anymore. I can't do it. She's like, you have to do it. I'm like, fine, because I'm only 40. And yeah, and that was an experience, but it was so intriguing because I get interested in this stuff. Thank God nothing, nothing.
Yes.
And then endoscopy we were curious about, and it showed an ulcer. So there was that. So he's like, all
Yes.
right, that would be the pain, but a little bit of the pain. Um, but I was like, wow, like I went and they tested all the pancreatic levels and a million blood works and whoa. But there's so much that it can be and then gratefully is not. But you have like once you have pain, you got to look at everything, it seems.
Yeah. And sometimes, I would rather be a little bit more cautious and look everywhere rather
Hmm.
than just assuming, oh, you know what, there's probably nothing.
Yeah.
I hate it when just when I know some doctors, some health people would say, it's just in your mind. There's nothing
Yeah.
else, and they completely ignore. And sometimes things can backfire, and there might be things hiding there. I usually the approach I do is this investigation workup for symptoms sometimes involves endoscopy, colonoscopies, and probably one cross-sectional imaging to see if there's anything which we cannot see,
Hmm.
using a scope. So things we have to look for. But I'm glad there was an
I know.
answer
I
for
don't
you.
know.
And
Yeah. I mean, I'm associating it as like a cold sore in your mouth, but in your stomach, and it's just very painful because it's just sort of like this open like sore. And yeah, I have like the reflux meds to take, and I'm not really sure what else Oh, and like don't be stressed, but like hi. Like I told everybody, guys, I'm supposed to be on bed rest, and like everyone's laughing. Like what are you gonna do? There's only so many lifestyle changes you can make. So I
yeah,
personally, I started taking supplements because I was already having a high fiber. They asked me all these questions. I was like, you don't know who you're talking to. I exercise every day. I drink tons of water. I have a high fiber diet. Um, so I do notice obviously triggers of more acid for the diet that I'm watching, but I've been taking supplements like turmeric and consistent with my supplements, turmeric and I haven't taken magnesium because I liked it, but my probiotics, and then I added another probiotic recently, and whatever I'm doing cocktail wise, it's actually helping. I
exactly.
noticed if you take it every single day, but that's because I had the baseline foundation of the good diet, working out, water.
Exactly.
So I went the next
Exactly.
level with that.
And when it comes to ulcers, right? I mean, one thing, there always is notions about ulcers. I've heard people say ulcers come from spicy foods. I heard people say ulcers come from
Seltzer.
from mental stress. Yeah. Um, so the thing is, the spicy foods per se cannot cause an ulcer. The most common cause why people get ulcers, one is NSAIDs medication like Motrin, naproxen, Advil, Aleve, all those. Two is H. pylori bacteria.
Hmm.
These are the two main causes. Now, obviously, if somebody has an ulcer, right, when they eat, let's say, spicy foods, obviously this can irritate and cause
Yeah.
more symptoms. So that somehow over the years got equated to, what, spicy foods cause ulcers, even though that's not the direct mechanism why people get
Right.
ulcers.
Right.
But again, all the more reason, when people come with those upper GI symptoms, especially if we look for certain red flag signs, like if there's noticing blood in their stools, wax stools, weight loss, close family history of any sort of upper GI malignancies,
Hmm.
age more than 50 sometimes is one red flag, and anything that just gives us a very low threshold to take a look inside, see if there's anything else going on there.
Yeah, it's very interesting. No, they did test for H. pylori. I didn't get the results yet. I have a feeling it's what it is, but I was like, it's okay. Like I'm very lucky to do what I do because I treat people with that too.
Yeah.
So I'm like, all right. So, like you said, and to answer your question about your other patients, I think I could relate to that because I'm feeling relieved already, just feeling like I am understanding what's happening, and I was so attentive because they said, let's say the impacted stool and all that, I can totally understand that that's not helping the area, like, and that's so I started being more attentive to, and
Uh-huh.
Dr. Walterman was on my podcast too, and she's also GI specialist. She talks a lot about pooping and
Yes.
time for poop and all that. And I'm like paying attention to that. Like I'm being more like, and it's very interesting because, like I said, I'm a very healthy person overall, like comparatively, but there's always another level you can pay attention to, So now all of a sudden I have like all these supplements and all these things, and because I need it, not that everyone needs it, and people should consult with an expert on them, and they do interact with some medications, but um,
Yes.
it's just like I love that. That's why I'm saying it with a smile. Because this is what I do. This is like who I am.
Yes.
I love paying attention to something else about myself that makes me feel better. So now I'm like, I'm having better stools. I'm paying attention to that. Like it did lead to a lot of other nice changes that are giving me a lot of relief. And now also, not only did it give it relief, it made the pain be super targeted. It's like it's
Yeah.
right there, because everything else was at play too at the time.
Nice. Yes.
So like you said, a lot it starts to if you take it seriously and you do your homework, you see your doctors, start unraveling the onion, peel the layers of the onion. You start to make lifestyle changes that you like, and this is what I talk about in the podcast. It's the gift that keeps on giving. It only makes you feel better, and then you also feel empowered. That helps you mentally. It's just crazy. It just so much.
You know, in terms of when we I mean, who wants to be on medications long term if there's no diagnosis and you're just going after your pain? So I tell them, probably, so as you said, diet changes, all those, work around, see what works for you. Aerobic exercise probably has a lot of benefit in terms of this kind of GI symptoms where we don't have answers. There has been times that I said, um, there has been literature around like completely non-medical stuff, like people have felt better with acupuncture, things like that. I'm like,
Hmm.
those are things that you can just explore yourself to see, if there do some research onto it yourself to see what others' experiences are. So when it comes to supplements, one thing which I always tell my patients is, and again, I cannot say anything for or against any supplements, but if you notice any sort of side effects or any new symptoms, first thing you should do is stop immediately.
Yeah, for sure.
Don't take anymore. And two is then definitely talk to your doctor.
Hmm.
Interesting, I recently had somebody came with severe nausea and vomiting, and when we did the endoscopy, this is probably the worst gastritis that I've ever seen. It was
Wow.
that bad. And, I take biopsies. I kept on wondering, this does not make any sense. And if you look inside the stomach, it's just one half of the stomach is inflamed, the other half looks normal. So, uh, only very, very rare things can do that, just affect one half. So, one is like blood flow issues to just one side has an issue, but he's very young. There's no blood flow issues. So the second thing is, if you're drinking something or taking something and you are laying down, things get stagnated just on one side. So I asked him, I'm kind of concerned if there's something that you drink or anything, if you just lay
It's okay. I could cut it.
down, that can cause inflammation just one side. And then he said, oh, you know what? That makes sense. I just 2 days ago, I started a new supplement. And
Which one though? I'm so
this was a
curious.
tea that he was taking which had ashwagandha in it, citrus
Oh
oils.
God, yeah, yeah. No,
Yeah,
I'm very careful.
there.
Yes.
So I made him stop completely, and he felt great after 2 weeks.
After 2 weeks,
Yeah,
right? Isn't that
yeah,
incredible? And I'm just so happy you brought that up because even as a dietitian who really again, it's very specific when I start recommending supplements. Like it's not necessary on many for many reasons and it's there to actually supplement,
yeah,
right? To help if you need it. But I'm not about these cocktails. I'm not it's also not an unregulated industry. So you really don't know exactly unless you can get something really reviewed and there are some that are reviewed supplements and then the only thing I would take that's some sort of a combination would be a broad spectrum probiotic
mm,
that I've actually looked into. Let's say when it comes to like, it's still having research for that and that probiotic. Otherwise, I don't think I ever take anything that has more than one thing in it.
exactly.
Like, and then you have, and also you don't know how much that's all being absorbed when it's mixed and they counteract with things. You have to be really careful
Yeah,
with herbs, and a lot of people have reactions to it. Wow,
yeah.
that's insightful. Okay, Dr. Shan, I'm so happy you came
Thank
on.
you
So
so
if there's
much.
something we can leave everyone with at a summary like message to leave people with, what would it be?
Um, I would say, if there's any significant symptoms, have a low threshold to reach out for help. And if overall things come fine, just listen to your body. Find that thing which works for you. If it is
Mm,
exercise, diet changes, just listen to your body, and it will tell you what works best for you.
yeah, That's true. It's very individualized GI. So, how can people follow you again? You want to shout out your Instagram one more time?
Yes, my Instagram page is gastroenterology.md.doc. Dr. Shan, gastroenterology. Awesome.
Amazing. All right. Well, thanks for
Thank you
coming
so
on.
much.
Don't forget to hit subscribe or follow me on Instagram and TikTok at Nourished by Beth, or listen on Spotify at the Secrets to Mindful Health podcast.